Now. Good morning, good afternoon, good evening. My name is Glenn Pierce. I'm the Vice President for Medical for the World Federation of Hemophilia. And it's our pleasure to invite you to a psychosocial and nursing perspective on COVID-19 called Stepping Up and Not Stepping Out. We have a distinguished panel from our nursing and social work committees, and we will be going through presentations and then questions and answers. Next slide, please. This is our panel. I've already introduced myself. I'm going to ask each speaker and panelist to say one or two sentences about themselves, starting with Ed, who's on mute.
Hello, everyone. My name is Ed Kuebler. Welcome to the webinar. Very excited to be here. I am a retired social worker from the treatment center in Houston, Texas, and currently doing leadership programs globally for the community.
Thank you, Ed. Richa?
Hi, everyone. This is Richa Mohan. I'm a clinical psychologist working with the bleeding disorder community from New Delhi, India. Welcome.
We're being asked to fix the volume. Kate?
Hi everybody, my name's Khair. I am a haemophilia nurse in London, in England, and I'm also the chair of the WFH Nurses Committee.
Marlène?
Good morning, good evening, good day everybody. I'm Marlène Beijlevelt. I'm a haemophilia nurse in Amsterdam, the Netherlands, and also part of the nurse committee of the WFH.
Thank you. And Flora?
Hello, I'm Flora Peyvandi. I'm adult hematologist working at University of Milan. And as a clinician, I did work in the COVID center in the last 2 months. I do apologize for my video that doesn't work very well.
All right. And we have Mace, do you want to introduce yourself?
Hi, I'm Mace Nakash. I'm a gene therapy program manager at the WFH, and I help organize these webinars.
And Donna.
Hi, everybody. I'm Donna Coffin, the Director of Research and Public Policy at the WFH. Welcome.
All right, thank you all. Next slide, please. This is our agenda. I'll make some opening remarks, and then Marlène will go into managing hemophilia and COVID-19 in daily life. Richa will discuss dealing with anxiety and fear. Ed will talk about isolation, and then we'll go into a question and answer period with the speakers as well as Flora and myself. Next. I do want to remind the audience that we have issued some statements which are present on the website, practical recommendations regarding COVID-19 specific risks to the bleeding disorders community, additional information on humanitarian aid news regarding the shipments of products, and then a series of company statements which we'll be adding to shortly regarding their products in the face of COVID-19. Next slide, please. These are the ways to ask questions. We have a button there called Q&A, and so if you, during these the talks, want to press that button and list your question, we'll be tracking it and can deal with it at the end. Next slide, please. We are recording this webinar, and it will be available tomorrow for anyone who wants to listen to it. Next slide, please. We were asked a series of questions in advance, and I'm going to quickly go through a few of the medical questions to get those out of the way. The first one is, are people with hemophilia at increased risk of having COVID-19? No. There is no increased risk to acquiring the infection. There is, however, there are a series of risk factors that will contribute to the severity of the disease. Next slide, or sorry, next question is, can COVID-19 be transmitted through plasma products? outbreaks. It's thought to be highly unlikely. This is being closely monitored by blood establishments around the world. At this point, there's no evidence of transmission. And then the next question is, does COVID-19 treatment protocol require special care for people with bleeding disorders? Next. Yes, the management is complex during severe COVID-19, and Flora will say a few more words about that.
Yeah, I think every patient who get infected and have symptoms for COVID-19 should get in touch with his center, because we should monitor the situation and the inflammation of the patient and to see the variation of the factor levels, and eventually if the patient is in clinical trial with non-replacement therapy, we need to understand what is the potency of the inflammation and activation of the coagulation. And based on that, we would manage a tailored type of anticoagulation if is needed to prevent any kind of thrombosis. So it's a kind of paradox situation, but we need to take care of both aspects of bleeding and thrombosis if is needed, and that needs the expert people.
Okay, thank you, Flora. Next slide, please. And then I'll also remind you about the virtual summit WFH is planning. During that summit, which goes from June 14th to 19th, on Friday the 19th, from 9 to 10 Eastern Daylight Time, we will be holding a COVID session with a series of speakers. Next slide, please. So we'll start now, and I will turn it over to our Nurses Committee, who will start talking about managing hemophilia and COVID.
Yes, this is Marlène from the Netherlands, and I'd like to tell you something about the accessibility of the hemophilia treatment centers during this COVID pandemic. And of course, all the accessibility of the hemophilia treatment centers will depend on the national, regional, and hospital advices. But I'd like to make the statement that all the hemophilia treatment providers will be available in all centers. And maybe this will not be in the way you are normally used to contact the center. Maybe some caregivers work temporarily in corona wards, or doctors and nurses work from home. But please be assured that your hemophilia team will be there and is still caring for you. This global crisis may lead to some faster developments and implementation of modern techniques, such as consultation via video, like we're doing right now. And in many countries, video calling can be made via a computer or a mobile phone, and the accessibility and availability of this way to communicate is possible almost all over the world. Through the video calling, your questions or even bleeds, all of it can be answered, and bleeds can be evaluated via video consultation. So please ask your treatment center about their options about the video consultations. Next slide, please. Next one. If, for example, you need to go to the hospital for the treatment of a bleed, it may be done in a different way than you are normally used to. For instance, in some countries, mouth masks are mandatory, while in other countries it is not the standard at all. And also, advices for corona testing will be varying from country to country. It is possible that you will not be tested if you don't have any corona symptoms, or that you will be tested even if you don't have any symptoms. So if you need to be tested, you probably will be scheduled by a health care professional, and the test will involve the spreading the nose and the throat with a cotton swab. And if you've tested positive, you should be staying at home, and then the information and questions will be by phone or by video. In some treatment centers, it is advisable that, like Flora already said, that you at least inform your general doctor about if you are tested positive, but at least inform your hemophilia treatment center about a positive result. In many cases, when you come to the hospital, questions will be asked whether, regardless if you are tested or not, you are free of corona symptoms for at least 24 hours. And also in many hospitals, there will be special rules for COVID suspect and non-COVID suspect patients. So, for example, you can't enter the hospital at the usual entrance you are used to. Most important message is that all hemophilia treaters will be there and will be available. It is possible that extra precautions will be taken, like for instance, next slide please, like for instance, that you can only come at a certain time in the hospital, because we don't want many people at one time in the hospital. Maybe it's not possible that you take along a lot of people to accompany you. For children, often only one parent is allowed. And please consult the rules of your country, your region, and your own hospital on what they advise to do in case you need to come to the hospital. And your hospital may also have arranged that your bleed is treated at home, for instance. Maybe home care nurses will be arranged. But I've also heard that young researchers, young doctors have been trained in a very short time to visit patients at home to help them treat the bleeds. Next slide, please. And what about surgery? Next one. In many countries, in the past 2 months, all planned operations have been cancelled until after the pandemic. But of course, it can always be that there is an acute problem which needs and requires surgery. Please remain alerted if you have any problem to be seen by a doctor, and which may include emergency surgery. Continue to report that you have hemophilia or any other clotting disease. And a treatment plan for surgery is always available from your own hemophilia treatment center. Maybe the follow-up after surgery might be different than you are normally used to. Maybe the time you will be admitted in hospital will be less. Maybe there will be no option that you will get any visitors. So it's all dependent on the regional and hospital rules. This is what I wanted to tell you about what our experiences are. It can be various all over the world, and I'd like to hand over to Kate, and she's going to tell you about all the stock of the clotting factors.
Thank you, Marlène. Now I've turned my sound up to as loud as it will go in my computer, so hopefully you can all hear. Could I have the next slide, please, Mace? So I'm going to talk a little bit about how to manage stock, and that is the amount of factor that you are able to keep in your house or in your region or in your haemophilia centre. So for those of us that are able to purchase our clotting factors direct from the pharmaceutical companies, so that's predominantly sort of Europe, Americas and Australia, we have no problems at all about getting stock into the country. So there is enough treatment to be able to treat any patient with a bleeding disorder when they come to clinic or at home if they're on home treatment. Now, I know that that very much depends on where you are in the world and whether you are able to buy your factor directly from the pharmaceutical companies. So for those of you who receive humanitarian aid via the WFH are working very closely to make sure that we can try to get factor into your countries in the same way that we have up until now. But it may well be that there's not as much factor coming in, and so you might be being asked to be a little bit more cautious about either having factor at home that isn't being used by you, that could be used by somebody else, or in terms of maybe not giving quite such big doses or treating smaller bleeds to try and eke out the stock that there is available at the moment. And so we're being quite cautious about that. Now, in the United Kingdom, and I know that in America as well, we're very lucky in that we are able to deliver coagulation factors directly to patients at home via home care pharmacy companies. And that is because that is allowed by law. But there are many countries where that is not allowed by law. And on the next slide, please, Mace, we can see that there has been some good news for those people who are within Europe. So the European Haemophilia Consortium, working with the European EAHAD, so the Association for Haemophilia and Allied Disorders within Europe, have been able to get the law changed so that patients with haemophilia and other bleeding disorders can have factor delivered to them at home. Now that might only be 1 or 2 doses, or it might be to continue with their full prophylaxis. The reason that that's advantageous is that means that those patients who might only ordinarily have 1 or 2 doses at home and then come to hospital to collect that extra treatment no longer have to travel. And so that means we're protecting them from having to come into the hospital and travelling perhaps on public transport, and so therefore reducing their exposure or potential exposure to COVID-19 in hospital. Now, that's a little bit of good news that's perhaps come out of this scenario, and we hope that after the COVID epidemic is over, that these patients will also be able to keep factor at home when they haven't been able to before. And I know that that is different than it is for many of you around the world, but hopefully if we can show that this works and is effective, we might be able to roll this out globally as we go forward. Next slide, please. So we also recognise that many of you are having bleeds that you are either choosing not to treat because you are sitting perhaps on the sofa and not doing so much exercise and you're thinking that you'll get away with it, or you don't have access to treatment. Either you don't have the access to the treatment itself, or you can't get to the hospital to get treated. And we know that when you bleed, you're in pain. And we know that that is something that we can manage even if you don't have access to enough clotting factor. Next slide, please. So we know that we can still continue to treat your pain in the way that we do ordinarily. So that's by using painkillers, so analgesia, and also by using price, the things that you would ordinarily do. So protection, rest, ice, compression, and elevation. But there are a couple of extra things that we just need to be a little bit cautious about for you at the moment in this COVID pandemic. There is some suspicion that some of the anti-inflammatory drugs, some of the non-steroidal anti-inflammatories, and particularly Nurofen or Brufen, might impact on COVID-19 outcomes. And although most of you won't take those drugs because we don't like people with bleeding disorders taking them anyway because they do mean you're more likely to bleed, you should be really cautious at the moment about taking that if you normally do. So please do discuss with your haemophilia team if you're taking non-steroidal anti-inflammatories to try to manage your pain. Next slide, please. So we also know that normality in life today is not how normal life was before, back in January or December, before this became a problem. And it's very easy to think that it's different for you because you've got a bleeding disorder than it is for other people who don't have bleeding disorders. And I think we should think about the questions of the things that I'm going to say now are actually applied to everybody, whether you have a bleeding disorder or not. There just might be some vague differences for you that do have. So what exercise can you do? Well, you need to obey the rules in your geographical area about going outside and think about social distancing. So if you don't normally cycle anywhere because you can't, because you've got painful joints, then don't suddenly think it's okay to get on a bike because your government says you can. If there are social media sites that you can access that give you information about exercise, which might be haemophilia specific and designed by your physiotherapist, see if you can find that information from your centre. There's lots of concern about how you would manage your family if you yourself are sick. And if that happens, then ask for help. Everybody has got a neighbour or a friend or a family member that will help deliver groceries if possible, things that will just ease how it is for you today. And think about what might help you and who you could ask that you wouldn't normally. So I live in North London and nobody in North London normally speaks to each other. We're all very isolated. And yet we now have a great community in our street. So everybody's shopping for everybody. Everybody is texting everybody else to make sure that you're okay. So just reach out to people that you wouldn't normally do. But please be very careful with what you see on social media. So limit your access, because actually if all that you're looking at is COVID-19 news, it gets very depressing. Don't listen and watch everything that is out there, and really trust your instincts. So if it sounds too good to be true or it sounds wrong, then it probably is. So please just be very careful about what you see and hear, and don't approve of all of it just because you've seen it on the television or on WhatsApp or somewhere. And we know that actually being at home is very boring. If you're stuck at home all day long with all of your children, all of your family that you're not normally with, and you are within four walls and can't go out, it is a bit boring. So think about things that you might be able to do that you wouldn't normally. So can you develop a new hobby? Can you do a bit more gardening than you normally would? Can you do knitting? Can you read or paint or do something else that is different that will get you through this time? And really take it all one day at a time. Don't think, oh, I've got to do this for another 5 weeks, it's awful. Think, I've got to do this today. I'll get through today and see how it is tomorrow. And remember to celebrate the good things. So it might be your birthday, it might be a sunny day, it might not have rained, or it might have rained if you want it to rain on your vegetables that you're growing. So try really hard to celebrate the good things and not always to focus on the bad things. We know that we can get through this, we will get through this. And I'm now going to hand over to Richa and Ed to help talk to you about how you can manage the psychosocial issues of this a little bit more.
So, hi everyone. We will be dealing with anxiety and fear in the pandemic and isolation in the next two talks. Next slide, please. So our talks would be covering dealing with anxiety and fear during COVID, stresses of increased anxiety, increased fears, domains of triggers, isolation, being alone but not by yourself, then defining isolation versus social distancing, managing your feelings, stimulated by fear and hopelessness, defining a new normal going forward and for now. Next slide, please. So, next slide. So, as we all know, the coronavirus pandemic has triggered a variety of mental health issues and possibly flared up existing conditions. There are certain common reactions to the COVID, and these can be different to different individuals. These reactions could be panic, distrust, uncertainty, confusion, etc. And all these leads to the main emotional reaction, which is anxiety. Next slide. So to understand anxiety, let us understand the normal fear response of the human beings. For example, when we see a snake, the first response itself is the danger, or it is a dangerous situation. We call it appraisal. So whenever we encounter something dangerous, our normal response is flight or fight the dangerous situation, and this leads to natural response, that is fear. Now, fear is the natural and protective response to danger, and it is protective and adaptive response to reduce harm to self. That means apprehensive reaction to danger is fear, and fear is an adaptive response. Next slide. So anxiety is a very similar feeling which leads to arousal in the brain and the body, different from fear in a specific way. It has nothing to do with the harm, but an overreaction to the consequences of an event, and in this case, the pandemic itself. Next slide. Let's look at the domains of triggers as to how people respond to these as anxiety and fears. This can be a public domain or a private domain. A public domain could be a disapproval, isolation at home, feel defeated by the virus. Private domain could be abandonment by their doctors or nurses, their significant others like family and friends, discomfort about losing a job, unproductivity, and have a sense of hopelessness or helplessness. How to approach the hospital in the time of bleed, what will happen if I don't have the medicine. These are the discomforts which falls into the private domain. So one should take a pause and think about that if you are feeling anxious for a few days, what are the triggers, whether it is a public domain or private domain. Next slide. So let's look at what are the unhealthy emotions and healthy emotions. So unhealthy emotions and what are the thoughts behind those? So unhealthy emotions are depressed, and healthy emotions will be sad but not depressed. Unhealthy anger and healthy anger. Anxiety is an unhealthy emotion, whereas healthy emotion is concerned and not anxious. Guilt can be unhealthy emotions, and healthy emotion would be responsible and not guilty. Similarly, shame could be an unhealthy emotion, and healthy emotion will be disappointment with self but not ashamed. Hopelessness is an unhealthy emotion, and realistically optimistic will be a healthy emotion. Next slide. So concern can replace fear and anxiety when there is no immediate threat. It is a healthy and negative emotion, whereas anxiety is unhealthy and dysfunctional emotion. Concern can replace fear when there is no immediate threat, and they can limit their hypervigilance time when there are high risk. For instance, they are going out to the hospitals or infusions, buying groceries, receiving couriers of AHF, etc. Next slide. Now also look at another reaction which is called worry. So there can be two types of worries, a productive worry and unproductive worry. Productive worry would be focused on immediate realistic problems, whereas unproductive worry will be focused on distant abstract problems. In productive worry, person will feels in control, whereas unproductive worry feels out of control. Willingness to experiment with solutions and coping strategies if the person has productive worries, whereas in unproductive worry, unwillingness to try any coping, and that has no guarantee. There is an absolute demand for certainty. Willingness to put up with risk and uncertainty, that is a productive worry. and unwillingness to put up with any risk and uncertainty. High level of efficiency in coping, that is the productive worry, whereas feels helpless and unable to cope is the unproductive worry. Focus on problems with building resources is a productive worry, whereas rumination is the unproductive worry as to what will happen, when will happen, what will my response, and all these things. There will be a lesser physiological disturbance in productivity, whereas unproductive worry will give you a high blood pressure or a fever or things like that. Next slide, please. So what could be the effective ways for dealing with this situation? Get realistic estimation of your personal coping resources. And these could be done by some strategies like organizing immediate surroundings, your workstation at home, cupboards, drawers. This will give you a sense of accomplishment. A sense of control will come through different activities. Like, for example, these days people are learning cooking and putting it on the social media, learning a new activity, increasing proficiency and language. A sense of belongingness and connectedness comes to the by talking to your friends and relatives over phone with whom you haven't caught up from a long period of time. Next slide, please. Sometimes people also have their faulty appraisals, such as their personal vulnerability. For example, if older people can have greater vulnerability to the virus and could be worse for them, that is a right appraisal. But sometimes people do not have a higher vulnerability, but they may start assuming that they are highly vulnerable to the virus or any kind of outcome that the pandemic can give. Such faulty appraisal can also be corrected, which gives them realistic picture of how vulnerable you are. Next slide, please. The realistic estimation of this risk will help one to be concerned and not anxious. And we all know that the anxiety is dysfunction and an unhealthy emotion. Some people have underestimation of efficacy of simple techniques like washing hands, social distancing. These faulty reference and appraisals need to be identified and corrected. Identify your emotional and practical buffers and spend some time to build them up. Identify the functional and dysfunctional behavior. Example, rumination, which is a dysfunctional behavior, and that should be stopped. Next slide. Information and social media, and Kate has already talked about it. So limit the time spent on the social media, like researching, forwarding, and reading the information, because it can give you a lot of information load and also not a proper information maybe sometime. This is important as there is a lot of conflicting information available. It is like watching a horror movie time and again. And when you watch this movie, so often your mood will be anxious or worried. So limiting your online time, offline time is very important. Make a routine plan of daily activities and follow it rigorously. Next slide. So I will leave with this, with a quote from Hans Seele, a physician who worked on the stress. It's not the stress that kills us, it is our reaction to it. Thank you, and over to Ed for the next talk.
Thank you, Richa. That was really good, helping us understand anxiety and start to talk about some of the things that we can do to move through this, certainly dealing with our fears. Next slide, please. So I wanted to take a little time and talk about isolation. It's a word that we've been using a lot and have heard for the past several months. And I think there's some places to get in between that and understanding what isolation is, and then how do we manage it within what's going on with COVID-19. So I actually just looked up the definition and found this. I think it's pretty simple and straightforward. The state of being in a place or situation that's separate from others. The condition of being separated from others, people, towns, and countries, which is clearly what we have been doing and have seen going on since we've been aware of COVID-19. Next slide, please. So social distancing, another word that we have been asked to understand, to practice, and a very simple definition: the practice of maintaining a greater than usual physical distance from other people, or of avoiding direct contact with people or objects in public places during the outbreak of a contagious disease in order to minimize exposure and reduce the transmission of infection. So that sounds pretty straightforward to what we're doing now, being asked to reduce COVID-19 and what they call flattening the line. So I'd like to take a few minutes going forward and break both of these down a little bit, because I think the isolation piece is where people are getting caught up. We're seeing a lot of psychosocial issues and concerns coming out of isolation. And some of that seems to be fed from social distancing and how people are socially distancing from others, and that it then feels like isolation. So let's break it down just a little bit. Next slide, please. So here's a picture I found, social distancing. Here's two gentlemen sitting on a bench, clearly more than 6 feet apart, but seem to be also isolated. And I thought this was a really good depiction of how sometimes with social distancing, as a request for us to do, can also become isolating. That we can actually be apart from each other and not engaging, not having any kind of dialogue, conversation, or interaction with someone, which then can feel very isolated, even out in a public place. So I thought that was really interesting for all of us to think about: when I'm socially distancing, am I also engaging in behavior of isolation? Next slide, please. So here's a slide I thought was really good to depict that. Here's a group of young ladies on one picture running what looks like a good 6 feet apart, which I was glad to see. But they're engaging in an activity. They're all involved in an activity while they are respecting boundaries, social distancing, and hopefully trying to enjoy themselves. And then the picture on the other side are two people biking, and again, they are hopefully distancing from each other, but engaging with each other and enjoying something together, which then changes the whole idea of isolation, that we can be apart from people, we can be away from them and still be engaging. And I think that's going to be the key for all of us to get through what's happening right now with this pandemic, is that we continue to socially distance, we continue to follow the recommendations, but what we can do is be able to engage more, is take some risk in engaging while we are socially distancing. Next slide, please. Okay, so I did notice in both those pictures, nobody was wearing a mask. And so I thought that was important to bring up, since we're all being asked to wear masks, maybe not this kind. So you sort of get where I was going with this, is we can do the things we want to do with social distancing, wearing a mask, washing our hands, the things that we're being asked to do, and maybe not quite so scary or a mask like this, but I thought it made a really good point that I did notice that none of the people in the pictures were wearing masks, so I thought I would mention that. Next slide. So what do we do with this? What do we do with feelings of isolation and fear? What do we do with loneliness? Those are the feelings that we as psychosocial workers, as nurses, you heard Kate talk a little bit about getting through some of this. How do we manage our families, our patients, our coworkers? How do we manage through some of these? And certainly with feelings of isolation can trigger some things. So I thought I'd take a couple of minutes and have you think about some of those. Next slide, please. So isolation can remind us of some things. It can trigger, as Richa talked about triggers, it can trigger some feelings It can trigger some past things. A lot of people have talked about feelings of being alone, that the social distancing and or isolation has triggered their feelings of being alone, which then triggers feelings of maybe loneliness. And so it's real important to understand, where are these triggers? Where is some of the isolation, some of the things we're being asked to do to change our lives so we can be safe and healthy? Where does that take some of us to places where we maybe get stuck, where we could get depressed and have anxiety? Fear of losing support. I've heard a few people that I've talked to talk about, I have such a great support system before COVID-19, and now it feels like it's diminished. I can't really be with these people. I feel like I'm losing something that I have built all these years. And I think that's a really valid point. But what's important to remember is we're not necessarily losing our support, but we're having to redefine what it looks like. We're having to pay attention to how we can feel and be supported at a time when we can't hug somebody or shake their hand or sit in a room next to them and have a meal the way we used to. So, but very important to notice if those kind of feelings are coming up and to be able to think about another way to manage them. A lot of times things like this trigger childhood memories, things that happened when we were younger that often drive our emotions and drive some of the things that Richa was speaking about earlier, anxiety and fear. And some people actually become afraid. They're scared of whatever happened got triggered by what's going on now. And it's important to know and recognize where some of those things are coming from so we can begin to get in front of them and be able to manage them. And then we can also become stuck in the fear. And I think that's really important to know that if we are fear-based, that can lead to feeling isolated, because usually in those situations, we tend to make things smaller. We tend to focus in and just look at one thing in front of us. We just get caught in a loop of those kinds of feelings, and it's really hard to pull our way out. And that's when you hear people start to talk about depression and some of the things that go along with that. Next slide, please. So I thought this was a great picture in understanding how do we navigate through some of the fear, some of the isolation. And I think it's important to understand we need to find a new perspective. We certainly are being directed and in some cases forced to change the way we live our lives. And for some people in a really big way. And for our families and patients, we've heard about a fear of not getting enough factor. How do we manage our treatment and those kinds of pieces? Well, that feeds into it. But I think if we can understand how we can navigate through this, it's important to know that probably most of us, if we've been around for a while on this planet, we have been through some very difficult, tough things and have managed through them. And so what we have is some remarkable skills, and we have a memory of getting through it. And I think this is a time when we have to remember those skills, when we have to take what we've learned and now focus them to what's going on with COVID-19, where we really just need to change our perspective. We can get through something big, and for most of us, we know how to do that. So I think it's important to remember a time when things were really challenging and realize what you did, what each of us did, and then to help manage ourselves through it. We definitely need to change our outlook because what we're looking at is different. So if we're still looking at and hoping something is one way and what's in reality is something else, it's very important that we begin to shift to what's real, shift to what we can see now. And one of the things that we can do is to take a step back, or 2 or 10, and begin to see things in a different way. Otherwise, it looks very focused, very tunneled, and very up close. Next slide, please. So here we have the same picture, but taking a step back. Instead of the center of one flower, one daisy, we have a field of daisies. And we can begin to see there's a lake or a pond in the background, there's trees, there's an opportunity for us to see the picture differently, which totally opens up what's available to us. We now have some opportunities to not just look at the middle of one flower, but to maybe pick a few of these and look at a bouquet of flowers, or look at a field of flowers and see what's possible. So it's taking a different perspective and to think about how am I focusing and what am I focusing on now, where I can shift that and begin to see the picture I'm living in differently. Next slide, please. I love this picture. Two fish. One is in a very small world, very isolated, and the other one has a bigger space. And I think that just comes from being able to create more space for ourselves. We may have to stay inside. We may have to socially distance and in some cases isolate from people. But when we change what we're doing, when we can do something different from within the boundaries we have now, we can have our space change, just like with these two fish. We can either see ourselves in a very small place, or we can begin to see ourselves in a place that is bigger, there's more around us, there's more going on, and we can pay attention to things that we haven't seen before. And so I thought about this as letting go of what we know, which is our security, and beginning to look at what is now. And when we can make that shift, then we begin to open up perspective, possibility, movement. We can actually have more room to move around, like we see in this fish in the bigger bowl. Same place, it's just how we look at it and how we manage it. Next slide, please. So my thought was that it is our time now to create a new chapter in our lives. This is something that we have in front of us now, COVID-19. It has changed the way we live our lives. It has changed what we know and how we deal with people, how we're around people. And it's really important that we take our power back in this COVID-19 pandemic, that we begin to rewrite the chapters going forward and what we need and want our lives to look like given how things are now. So definitely it includes being safe and doing all the things that we're being directed to do, washing our hands, socially distancing. We need to be informed, and you heard some really good direction on what that means, to not take in everything you're hearing and reading, but to be selective, but be informed so you know what it is you need to do as you write your next chapter. And then of course, protect yourself and others. And that was that whole piece about wearing a mask and doing the things we need to do so we do not get infected or infect anyone around us. So I invite you to write the next chapter in your life, to take a little time when this webinar is over and think about what is it that I can do different, and look around where you are and see what's possible. And don't just see it for how it looks every day when you're looking around your home or where you are, but begin to see it as a place where you can make some changes, where you can change the way you are living in your life. So I invite you to write the next chapter, and hopefully, as I see on this book here, and they lived happily ever after, as every good positive book ends with, is hopefully a story that we can be proud of and talk about later, that will bring us a new perspective, but also some joy and happiness. Next slide, please. So thank you for your time, and I invite you to do that. And I will pass this on to our next speaker.
Thank you, Ed, and thanks to all of our speakers. We're now going to move into a question and answer period. Before we do that, I do want to offer special thanks to the Hemophilia Alliance. It's an organization here in the United States which works with most of our hemophilia treatment centers to provide clotting factor. Joe Puglisi and the Hemophilia Alliance have been funding travel grants, but since we are not traveling, they've offered to fund webinars such as this, and so we appreciate that. Next slide, please. We'll now go into questions and answers. We have a few that came in ahead of time. Next. I'm very worried about the situation. What can I do to worry less? Richa, I just want to remind the panelists, short answers, we have a lot of questions. You're on mute, Richa.
Yes. So I have already shared a slide of productive and unproductive worry, and worry is one reaction to the situation. So you can self-test yourself on 1 to 10 scale where your worry lies. And if it is lesser than 5, then you are into the lesser worry situation. And if it is more than that, then look at the slides which will be available for you, and you can move yourself to the productive worries there. So this is just a reaction, and when you check and validate your worry, that will of course come to help you.
So the next question up here is, how can I overcome the mental stress from COVID-19 that results in skipping doses? The short, fast answer is don't skip doses, no matter what. However, we did just go through some information about anxiety, stress, and fear that can affect our normal routine. So I would ask you, anyone who is wanting to know how do I manage this particular question, is to put your health first and to make sure you're doing everything you need to do to manage your bleeding disorder, and to deal with if you're having some issues around feeling depressed and not wanting to do things, that you reach out and talk to someone. But by all means, at the top of your chapter that you're going to write is that I will take all my doses and keep myself healthy.
And what if you don't have the doses to take?
So not having the doses definitely changes the situation. And as we know from before COVID-19, there are things we can do to protect our joints. There are things we can do to try to manage our bleeding disorder without having factor concentrate. And those are going to be really important at this time, that you do the things you know to do, to remember the things that you have learned, so you can manage through this until we can get all of this in a better place. But definitely, if it starts changing how you feel, to reach out and talk to somebody. But by all means, remember what you know about how to take care of yourself in lieu of maybe not having enough factor.
Thank you. Next slide, please. How can I manage my fear and concern about my children? And we also have a question here about managing with smaller children.
Yeah. So we have already talked about the strategies again to manage the fear and concern. When it comes to the children, it is little tricky situation, but you can, according to the age appropriate child, you can still devise a task, involve them into different household chores these days, and they will be willingly and happily doing that. Again, the routine should not be disturbed, their study time, their play time. Also, of course, we have talked about social media, but sometimes they can, contact their friends through social media or through video calling, and so that they feel that connectedness with their friends. So this could be some of the strategies will bring down the fear and concern about the children.
Okay. Flora, here's a question. We've gotten the question on Kawasaki. A couple of more have come in as well. And just if you could maybe provide a broader perspective. Every week we are learning about a new organ system that is affected. So we have COVID-TOE, we have Kawasaki's in small children. What should we be thinking about with regard to the disease process as well as the virus that causes it?
Actually, I was just talking. Can you hear me?
Yes.
Because I tried to, yeah. Regarding the disease, I think it's very important to understand how the disease is happening. As you know, the virus is attacking, making a big attack to the endothelium, and that is happening mainly at the lung level. But that's not the only endothelium, could happen everywhere. And that's what we are hearing every day, the different clinical picture, and that depends on which stage the patient arrived to our observation. So that's the reason why at the beginning of this epidemic era, we were seeing the patient with a problem of respiratory failure or the lung issues. But now we are starting to see other type of symptoms like gastrointestinal problem or dermatitis, or even you've seen in the children the new symptom like lupus or the Kawasaki, because I think that's all the inflammation defense of our body against this virus attack to the endothelium. And that's the reason why we are facing up with the different pictures. So what we need to know, actually, I think for this audience is important to know, we are facing up with a huge inflammation, at least in the first month, because things I think is changing now for two reasons. First, because the patients are arriving earlier. Secondly, I don't know if the picture of the virus is changing, is adapting to our life, but the severity of the disease seems to be less severe. But at the beginning, we had a huge inflammation due to the activation of endothelium, which leads to the activation of the coagulation. And sometimes also the autoimmune system could be altered. And that's, I think, what we are seeing every day with a different picture.
Okay, very nice explanation. Thank you, Flora. Our next question, should I change my child's treatment, such as increasing infusion frequency? And along those lines, there's a related question. Is it possible to have more bleeds because of stress and anxiety? Kate, do you want to lead on that? You're on mute.
Can you hear? So I don't think you should change your child's treatment infusion frequency unless there is a reason to do that, that is bleeding disorder related. So two reasons for that. One is if you only have a limited amount of stock of factor and you use it up and you can't get any more, then actually you won't have any treatment to treat your child with or yourself if you bleed. And unless you're moving from on-demand treatment to prophylaxis in a way that was already planned, there's no real reason to change. What I would say though is if you are on prophylaxis and you're supposed to do it for your child 3 times a week and you've only been doing it twice a week, then actually there's an argument that you should try to stick to the treatment as prescribed, because if we can stop your child from bleeding or you from bleeding so that you don't have to go to hospital, then that's obviously the best situation for everybody. With regard to stress causing more bleeds, I have heard arguments in both directions. So some people say that they bleed more when they're stressed. And I think if you think about why that might be, if you're rushing around and you're maybe a little bit less cautious than you would normally be, you might be more likely to fall and injure yourself. So perhaps you might bleed a little bit more. I don't think there's any real reason that we could explain other than that as to why that might be.
Okay, thank you. Next slide. Is there? Yeah. I'm getting restless at home. What can I do?
So I'm getting restless at home as well. So it's not about having haemophilia or a bleeding disorder. So I think it's trying, as Richa said earlier, trying to maintain some of the normality of your life. So getting up in the morning and, you know, getting dressed and going out for a walk if that's what you normally do, going to work if you're allowed and if you can. To think about if you have children, trying to do some schoolwork with them, but also not making it too stressful at home. It's not all about education in terms of book learning. You could be teaching your children a new skill, so maybe painting or making cakes or something. So try to do different things and plan to do them and do them if you can. If you're allowed out to take exercise, even if that's just walking the dog or walking around the park, then try to do that as well, because actually being outdoors does make you feel better.
Okay, thank you. Are there psychosocial risks associated to the end of self-isolation and confinement? Ed?
I was trying to understand what this question was asking about psychosocial risks to being able to now go out and be around people and be out and about. And I'm not sure what the risks would be other than getting too excited and too happy and running around. But I think it's just important that, you know, it'll be again a change, but it'll take us back to hopefully our normal, or a part of our normal, and that remember that that's very important for how we will feel psychosocially, psychologically, is that it's then reminding us that we still have some things we have to pay attention to, but definitely taking us back to a normal. So I'm not sure of any psychosocial risks. I don't know if Richa has any ideas on that, but it seemed like it's a pretty good thing to me if we can get to the end of self-isolation and confinement.
Just to add a bit, it could be, we can understand here from the psychosocial risk is sort of post-pandemic, what could be the mental health, and people can still be anxious, still be fearful. So as we have already talked about, look at the strategies, look at your the things which you were doing before. It has to be contained, and it has to be done regularly, even the post lockdown or COVID situation. So
yeah, and I was also thinking before the webinar was set up, is there will probably be some issues around post-traumatic stress, especially those people that have been on the front lines, those people that this has triggered some things for. And it may be important to pay attention to, as Richa was saying, some of these things post-pandemic that we see showing up and we need to then be aware of. So other than just the joy of now I can go out of my house, for a lot of people, this can create some stressors, and even post-traumatic stress disorder can come out of it. So it definitely is something to pay attention to, and maybe what this person asking the question was referring to.
Okay, thank you. Another question, how will this affect the countries on factor donations? The WFH Humanitarian Aid Program is continuing, and under the leadership of Assad Hafar, they have had to get very creative with some of these shipments. Many small airports have been intermittently closed, not only to but to cargo. And so we've had some spot shortages in various countries that were due for shipment, but because of COVID-19 have not been able to receive it. I think that the team in the WFH headquarters in Montreal has been able to deal with most of that, but it has resulted in some compromise in the treatment plans for patients, which is difficult. So people that were on some prophylaxis, we have asked each of the treatment centers to restrict it as needed based upon their supplies until we can get more to them. We have two related questions. The community in the past has gone through HIV. Are we more prepared? And along with that, have you noticed that the past traumas for people with bleeding disorders are coming up again in the midst of this trauma?
So shall I start? So
Sure.
I think that as a community, certainly the people with haemophilia and other bleeding disorders have gone through already, you know, horrible stories that they have coped with, and that shows a huge degree of resilience within the community. And I think that that is something that you can share and continue with as individuals, to be resilient and to cope. And I think you know, you've got through other things, we'll get through this. I don't know, I've not come across anybody who is suffering more about HIV now than they were before, but others may have. Marlène, I don't know, have you seen anybody? Or Ed, or Richa, anybody?
Yes, I've seen a lot of them, and but as you already said, there's a lot of resilience, and I think we can get through this as well.
Glenn, can I add something on that?
Yep.
I think actually this is not really comparable to HIV, and we have to differ these two situations. In 90s, the situation that we were living with HIV was really something related to something really related to this society, and it was completely different. Fortunately for the COVID, there is no association between coagulopathies and COVID infection, and that should be very clear for the patients.
Yeah.
All discussion is around if a patient with coagulopathy get infected with COVID, how we have to face up with that. But over there was a high association between the HIV and the situation of the patient with coagulopathy. But here the thing is completely different. I would defer that.
Yeah.
There's another question regarding antibodies against COVID. And maybe I just read the summary of the last couple of days' news this morning, and we still don't know for sure if developing antibodies is protective from reacquiring COVID or protective from you transmitting it to another person. There's a little controversial information, yes, no. So I think within the next couple of weeks, we're going to have a much better understanding of exactly what antibodies can and cannot do. But for now, it's not clear. So hang on and stay in touch with the news. Flora, there's another question on non-steroidal anti-inflammatories for joint pain.
Yeah, I saw actually the presentation. I think, to be very honest, there is no association scientifically valid to confirm that we do not have to use a specific drug, a part of what we know. We cannot use the aspirin, we cannot use those drugs that could alter the coagulation, the first step, and interfering with the work of the platelets. So that kind of product, we were not using it anyhow. But a part of that, I think, no really scientific recommendation could be done for any specific drug. So the most important information that I want to say is start the treatment as soon as possible, because once the endothelium get attacked and the inflammation is starting, the process is like a cascade. You cannot block it anymore. The most important thing is start the treatment as soon as possible.
All right, thank you. I think I've covered most of the questions. If anyone sees a question I've missed, feel free to jump in. There is one other. Some people have lost their jobs and are really in some more severe financial difficulty than they might have otherwise been. Do any of our panelists want to comment on that situation? It affects everyone, but in our particular community, the impact of that.
I would comment that it is really challenging, because I'm watching the news every morning, and they list it in the United States how many people are out of work, how many people are filing for unemployment, and then you take that to other countries, and then countries that have less than we do. It has to be very, very devastating, and it has to be frightening for a lot of families. And what I look for in those reports from trusted news sites is there are places that are helping people. There are places that are helping with food if you need it. I see a lot of people, organizations, private companies stepping up, at least here in the U.S., to help with food. I see there's news about a lot of the institutions, banks, and places are giving a grace period for home loans and things like that. And so I don't know that there's a good answer to that, other than some of the skills we talked about in this session and some of the things that you can do at least within your own homes and where you are, is to try to not sink into it with the realities going on around you, that I just don't have enough. How do I feed my families? How do I take care of my rent? There is no easy answer for that, other than to get rid of this virus, to do everything we can to minimize what's going on, down to a place where we can get back to work, we can get back to the things that are important. So I wish I had something more other than look locally where you live and see where there are places that are offering support. And as someone said in the talk, is ask for help. As I said, I listen every day and I hear new resources every day. So that would be my only thoughts and suggestion on that.
Okay.
Glenn, if maybe I can add just something. This is a little bit probably political issue, but I think we do need to have a kind of harmonization about how we have to face up with this phase 2 step, because there is such a heterogeneity even in Europe. So today, for the first time, fortunately, after 2 months, we are opening partially in Italy, but you know, the children would stay home, the moms, some of them should start to work, but how they can. So there is really not good organization. And I think that's really a difficult issue. It's not an easy job for the governments, but I think they have to put together and they have to come up with a harmonized and thinking of people and the future of the society.
I think
and that's what we experience here in the Netherlands as well, as schools will be opening again, and parents are very afraid of sending their children into the schools again. And I hear a lot of anxious parents, should I keep my child at home? Should I send them at home or at schools? And I agree, there has to be more equal advices of what is good or what is dangerous.
Well, I think you both have raised an important whole category of issues in the phase 2, or reopening each of our countries, and the stresses that we'll undergo there. So I think that could wind up being the topic of another webinar in the near future, something for us to consider, because there are a lot of variables. We share common ones, but we're all on different timelines. With that, I think I'm going to, I think we've covered it all, and I'm going to sign off. I want to thank our panelists for a well-organized and coordinated series of presentations, and thank our audience for all of the comments. Many comments have been raised in our both chat box as well as questions and answers. And so if you've been tracking those, a lot of good ideas have also come out of that. Thank you all, and
thank you.
Good rest of the day.
Thank you.
Bye.
Thank you. Bye.
Bye.
Be safe.
Bye.